Hi everyone and welcome back to It's a Twin Thing. I hope you all enjoyed yesterday's clip on crawling. Today's topic is teething. This can be a really hard one and every baby is different. On average, most babies start sort of teething around the 6-month mark, but it can happen as earlier than that. It can happen at 4 months, 2 months. Some babies are even actually born with teeth. It's really one of those things that's just any time. Some babies don't start teething till they're 9 to 12 months. So just bear in mind that, it is very, very there's very different degrees of when it can start. However, little things to look for, so little signs or symptoms as to what could happen when they do start teething. Basically, there could be some irritability. They can lose their appetite a little bit, so they may start grazing a little bit more. They can get a rash around the mouth, rosy cheeks, slight fever, diarrhea. So there's a number of things that the gums can sort of swell a little bit. Teething can kind of take a while, or it can happen overnight. I know with my daughter, she was quite irritable for a little while, and she had sort of rosy cheeks and she was drooling a lot, but there was no teeth. It was white sort of at the gum, but there was nothing that had cracked through. And then one morning she woke up and the tooth had cracked through. So it's very sort of up and down, but you've just got to monitor it and just make sure that they're sort of semi-comfortable. A few things you can do to help with teething. I know at the supermarket or a Baby Bunting or even the chemist, they have these, they're like chilled teething toys. So they're basically a bit of plastic, and you can put them in the fridge. So when the children put them in their mouth, they're quite cold and it's actually quite soothing on the gum. So that may help. A little bit of Bonjela, which you can also get from the supermarket or the chemist, just a little bit on the gums. Massaging the gums is actually quite soothing for them. And I found, so if you're a parent that wants to use baby Nurofen or baby Panadol, I started off with the baby Panadol, which was every 4 hours. I found at times it took a little bit of the edge off, but it didn't give them complete pain relief, whereas baby Nurofen worked a lot better because it's anti-inflammatory. So if there was any swelling within the gum area, it actually helped reduce the swelling as well. And the baby Nurofen can last 8 hours, so they're not having it as frequently. So that it just depends on what you want to do. If you don't want to do any sort of medication at all, there are natural sort of remedies that can help. And so you just got to work out what works for you. I find sometimes the dummy, I guess some parents, like I said last time, pro dummy or not, the dummy does help with soothing. And depending on how old your child is, I would sometimes give the kids cold carrot just to sort of gnaw on, or teething rusks. And that would help too. So, like I said, it is a bit of a journey. It can disrupt their sleep. So, at times, if they're in pain, they will wake, and be unsettled. So it's just, a few more cuddles and a few more, just that little bit more nurturing can sort of help them settle a little bit more. But it is a process. We all go through it. And it's quite ironic. I remember once I was talking to a friend of mine, and she said, I said that I felt for the children because they were in pain because of teething. And her response to me was, do you remember being in pain teething? And I actually don't. I don't remember that as a child at all. So as much as it's hard, before you know it, will have forgotten what teething is. But unfortunately, they are in a bit of pain when they can be in a bit of pain when they teeth. And it is a bit of a process. So it's, and some babies don't hurt at all. Some babies don't go through any pain. Like my daughter, who's normally quite, nothing tends to faze her very much. She went through a fair bit of pain with teething. Whereas my son, who's a little bit more sensitive to things, he was teething, but you wouldn't know it, sort of thing. So Daniela sort of got her first tooth around, I think it was 8 months, and Joshua around the 9-10 months. But for her, she was sort of in pain for a good 2 months prior to the tooth actually coming through. So it's just something to look out for. If you have any questions, do feel free to contact me. And tomorrow I'm going to be talking about sleeping. So routine, non-routine, unsettledness. Some babies sleep, some babies don't. So tune in, have a great day, and we'll see you all tomorrow. Cheers.